Finishing up this week in Central New York, very glad to be talking to Dr. Henry Weil. Before we talk about what you're going to talk about today, first of all, welcome to the show and tell us about what you do at Bassett Healthcare.
Thank you, Eric, and nice to be on your show. I'm an internal medicine physician by training, have been at Bassett for a long time. I have a couple of roles here. I'm something called the Chief Academic Officer, so I think that's why you're talking to me today. That has to do with medical education, which has been a 100-year major mission of Bassett. And I'm also something called the Chief Clinical Officer, and then I'm involved in overseeing the Columbia-Bassett Medical School program, which I think is what we're going to talk about today.
We indeed are. Very exciting news. We got the press release recently, Bassett welcoming the Columbia-Bassett Class of 2025. For the listeners not too familiar with what this is, what is it all about, Henry? Tell us more.
Well, so of course, I think most people listening to your show will know that to become a doctor, you have to go to med school. And medical school is a 4-year program after college. Everybody who then practices as a doctor, they graduate from medical school and they go on and do something called a residency. So you graduate from medical school and might decide you want to be a general surgeon, and you have to do 5-year residency on top of the 4 years of med school. A lot of those people will then do a fellowship, might be in a special kind of general surgery, and that might be 2 more years. So med school is sort of the beginning of a long process in terms of training to be an independently practicing physician.
With any profession, you have to have a true passion. You have to really love the profession to devote this much time and training. You know, I went to broadcast journalism school and I was done in 4 years, but that's just pretty much the beginning in the medical profession.
I think that people training to be doctors share in common with you, as you say, a passion for what they do. And this is true for a great many people in our society, and I think should be true for everyone if our society was truly fair. But there's no question that to enter medical school, almost everybody does it with a lot of idealism, hoping that they can help individual people and leave the world a better place. And I think the fuel that gets them through such a long period of training.
Tell us more, Henry, about this Columbia-Bassett program.
It's a joint program with medical school at Columbia University and Bassett Medical Center. We started in 2010, and we've just been extremely lucky from the get-go. So we have always had hundreds of applicants for our 10 spots. So we have 10 positions out of a little less than 150 in the whole med school at Columbia in this 4-year program. People apply to go to Columbia to be part of the Bassett program by a slightly different mechanism than to go to the traditional program there. And again, we've had hundreds of applicants per space. And those applicants have been extraordinarily gifted people in terms of their capabilities in science, their mission-driven spirit. We've been able to recruit our classes of 10 students with some of the fewest offers each year to fill our class. So many med schools, if they have 100 spaces, they might have to make 200 or 250 offers to fill. Last year, for example, Columbia-Bassett had to make 11 offers to fill our 10 spots. And it's just an indication that the things that Columbia and Bassett are doing in this program are unusual, and they are highly attractive to idealistic and mission-driven young people. You might ask, what are some of those things that we focus on? And there are really 4 of them. One is that we're really trying to do our small part to get more physicians who want to practice in rural areas out in the world. And there is a real disparity between the number of doctors right now practicing in rural parts of America versus suburban and urban parts. And it has obviously an impact on the health of people in rural places. It's a big problem. Turns out that people who come from rural places or choose to train in rural places, either one, are much more likely to spend most of their career as a doctor in a rural place. So the first of the 4 things we're most focused on here at Bassett with Columbia is getting more highly gifted people to become rural doctors. The second one is, I'm sure all your listeners are aware, there are actually a lot of problems in healthcare, problems of access, problems of fairness, so that no matter how much money you have or where you live, you get equally good care, and some other technical problems that I think many of us as patients experience and are aware of. Most doctors don't get training in how to solve, let's say, workflow problems, like the ability to get patients in, have access, and get the right care at the right time. We are training these young doctors in an array of performance improvement skills so that wherever they go, if they encounter a problem, they will have the skills to solve that problem, the knowledge of who to seek out in an institution to work with them to solve that problem. So that's the second thing. The third thing is the idea of longitudinal care, of taking care of patients over a chunk of their lifetime, as opposed to just doctors who see a patient once or twice and never again. And it's well known in healthcare that patients are safest and have relationships that they find most fulfilling if they're with the same physician for a long period of time. So we're very focused on that. And then lastly, we are extremely focused on training young doctors to take care of the whole patient, not just their physical needs, but so many of us also have needs related to stress or other emotional needs. And healthcare is the place that people often think they should get help with that. And yet most doctors aren't trained and equipped to either help with it themselves or help those patients get to the care they need. So those four things, which are much more emphasized in the Columbia-Bassett program than most med school programs around the country, have really struck a chord with young people. That's probably why we get so many applicants and why when we offer a position to someone, they're pretty likely to come.
And when you mentioned the rural area, and that is the first point of emphasis you brought up, I'm not sure what a person living in the city, when you say rural to them, what their perception is, but phenomenal answer, Henry. Thank you for all the information. One of the first words you said in your response was rural. Talk about the challenges of being a rural doctor, especially in this area.
In lots of the townships that comprise our area, the Bassett serves an area the size of the state of Connecticut. And a lot of those townships, there are less than 30 people per square mile. And of course, in that pretty much 5,000 square mile area, we have a number of small hospitals and then the main medical center in Cooperstown. In a square mile of Manhattan, there are multiple hospitals, no matter what square mile you pick. The challenges are much different out here. Hospitals all over the United States, whether they're urban or rural, are really struggling right now because related to the pandemic and other factors, so many people are leaving healthcare right now. So 1 in 5 doctors has left healthcare. 1 in 5 nurses, and indeed 1 in 5 people who work in healthcare have left since the pandemic started. I think that patients everywhere are feeling that in terms of access and responsiveness. Not only is it challenging just to be in a rural area, but to be anywhere right now as a patient is challenging, and in some ways those things are heightened in rural areas.
And why 10? Why is the size of the class 10, Henry?
There are a couple of factors that get a little technical. One has to do with the preclinical part of medical school, which is the first 18 months at Columbia. So there's only so many more people they could add to a class because of their space down there. It also has to do with the scale of Bassett, and we really want to give these people a phenomenal training. You have to have the right number of teaching physicians for the number of learners. Those two things are both factors. We actually could increase our size a little bit, and we might sometime in the next couple of years because, there are so many deserving young people who want to train with us. It always feels terrible that we can't take all of the ones that deserve to train here. But we're never going to be, the size of a typical med school. It's part of the problem of rural areas. The scale of the hospitals is so much smaller than your typical urban hospital. Therefore, you can't train as many people.
Let's just talk about the partnership. I mean, two superpowers, Henry. You have Bassett Healthcare and the outstanding reputation and the outstanding work you guys do every single day. And then, of course, you guys are partnering up with an Ivy League school in Columbia University. Just talk about a little bit about this partnership that seems to be working very, very well.
Well, it is working well, and I think in 2027 we celebrate our 100th anniversary of being partners with Columbia. We've had medical students here since actually 1931 consistently. A partnership that's born of a lot of things, a mutual desire to train young people to go into medicine. Columbia has had, and then they have a new dean, Katrina Armstrong right now, who's just a wonderful person, has had an interest in rural care, and she's in particular interested in sort of righting the imbalance of the number of doctors in rural versus non-rural areas. It's a very living relationship, and it's based on a mutually shared senses of mission. And then underneath all of it, of course, is no matter where a person is, having the desire that that person get great care. To be a rural organization with a place like Columbia helps us maintain the highest possible quality here. And also having programs like Columbia-Bassett helps us attract really, really good people of all different descriptions in healthcare, nurses, radiology technicians, people in the cafeteria. But it helps us attract really tremendous people because we're aligned with such a high caliber place like Columbia. The key to the Columbia-Bassett program is the faculty at Bassett. And the faculty is composed of many, many doctors who have faculty appointments at Columbia and choose to be working in the counties that comprise the Bassett area of care. It's also advanced practice clinicians, it's nurses, and a host of other people who have different roles at Bassett. All of those people are teaching our young students and helping them learn how to relate well with patients, be open and helpful to them. Perhaps most important thing I can say today is it's the people at Bassett that really make the difference, both for the care of the patients and for the people who are training here.
All right, Henry, it was an absolute pleasure talking to you. Thank you so much, and hopefully we talk again.
I'll look forward to it. Have a great day.
Once again, that is Dr. Henry Weil, and that will do it for this week in Central New York.